cut it.
Why?
Because, I messed up my face.
Oh, okay, hold on. We'll just do. All right.
Come in.
Hi, my name is Reva. I'm going to be your nurse today. How are you doing?
Good, good.
Okay, great. We're going to do a chest and respiratory exam today. So I'm actually just going to look over the floor, make sure there's no safety concerns for me or yourself. Let me go ahead and wash my hands for 20 seconds. I am going to pull the curtain for some privacy, okay? All right, Zachary, we're going to do that exam. It's going to be a chest and respiratory exam. Like I said, I need to go ahead and verify some identifiers with you. Can I go ahead and have your armband, please? All right, can you have your name and date of birth?
May 27, 2008.
And your name?
Zachary Atkinson.
All right, Zachary, perfect. Thank you so much. So I've provided us some privacy here. Can you tell me where you are?
In the hospital.
Perfect. And what brought you to the hospital? Just make it up.
Had a heart attack.
A heart attack, okay. That's fine. Can you tell me who the president is?
Joe Biden.
All right, and you tell me what year it is?
2021.
2021. Okay,
Yeah.
perfect. So patient is alert and oriented ×3 of oriented to situation. Let's see. No slouching, posture is really well, straighten up back, so he's pretty good holding himself up. That's good. His skin has no bruising lesions, discoloration at all, and his skin is appropriate for his skin ethnicity, okay? I'm going to go ahead and listen to you, so we're just going to take a few minutes to do that, okay? All right. The first thing I'm going to do, is listen or feel your carotid artery, so if you just nice and straight for me, okay? Perfect. Okay, and then I'm going to do this side. Okay, and then I'm going to take the bell of my stethoscope, and what I want you to do is just breathe in, let it go, and then hold it for a second, okay? Breathe in. Out through your mouth. Out through your mouth. Now hold it, and then let me listen. Perfect. We're going to do the same thing on the other side. Breathe in. Breathe out. And hold it. All right, no bruise notated bilaterally. All right, I am going to go ahead and feel your chest wall and chest cavity for heave and thrill, okay? All right, you just want to sit up nice and straight. All right, no heave and thrill notated bilaterally. I am going to go ahead and listen to your heart at this time, okay? And again, I just want you to nice and straight for me. All right, so I'm going to go ahead and listen to the aortic valve. This is going to be on the external sternum. Okay. Perfect. I'm going to listen to the pulmonic, and it's going to be on the right side of that sternum border. Perfect. And this is in the second intercostal space on the left and the right. Now we're going to go down to Erb's point, which is not a valve, but where S and 2 are heard equally in this area, and this is in the third intercostal space. All right, and then we're going down to the fourth intercostal space where, and if you just hold this up for me just real quick, the third intercostal space where I will be listening to the mitral valve. All right. And then this mid-clavicular line is the tricuspid. So you want to go right here in that mid-clavicular line right down. And then I should be able to, if you just hold that chest up for me just a little bit. All right. And then we're listening to the tricuspid valve. And that's going to be in that 5th intercostal space, mid-clavicular. Perfect. So everything there sounds pretty well. S1 and S2 were heard with no murmurs or Okay. So the next thing I'm going to do is I'm going to listen to your chest. So for this, I'm going to start at the top of your chest and we're going to move down. Because this is a video that we're doing, I am going to have you do the first 2 breaths for me, but after that, feel free to breathe normally. And I'm just going to be showing placement on your skin, okay? All right, Zachary. And if you just sit up nice and tall for me, I really appreciate that. Thank you. So we are going to do above the clavicles here. So I want you to take a big breathe in, out through, in and out your mouth. Perfect. And again here. All right. Perfect. All right. So I'm going to go here. Nice deep breath in. And you want to open up. There you go. With the mouth wide open. All right. Perfect. Now right here. Go ahead again. All right, and I'm going to listen underneath your arms. All right, and go ahead and breathe in and out again for me. Perfect. Good. And I'm going to come on this side and do on the other arm on here. I just want to listen to these auxiliary sounds, okay? Again. All right, again. All right. Lung sounds are clear in each lobe and no auxiliary sounds as well, so everything is clear. I am going to go ahead and have you at this point, I need to listen to the back. So if you can just turn on your chair for me, and actually if you just hop off, and I'm going to turn it this way and make sure your pants are pulled up so we'll see your butt crack. Okay. All right, there we go. And nice and tall for me, Zachary, if you can please. All right, so we're going to listen to the posterior lung sounds. So I will be starting again at the clavicular section and moving myself down to the thoracic region. And we're just going to do a total of 10 different spots on the back as well. So go ahead for me, Zachary. And full open mouth. Breathing out, full open mouth. Perfect. Again. All right, and now we're going to stay within this space right here. So we want to go in between the scapula, so on either side of the vertebrae, so we're not listening over phone. So I'm going to start here, nice and straight. All right, and we're going to listen to breath sounds all the way down. And we're moving side to side in order to compare each side. And Zachary's doing a great job here. All right. Posterior lung sounds are clear in all areas and all lobes. So go ahead and turn around for me. Okay. So I do want to thank you for letting me do that. Do you have any questions or concerns about what we did today?
No, ma'am.
No? Okay. Do you have any questions or concerns about your procedure that you'll be having later on? We're going to be going ahead and putting in a stent in your heart. And do you have any questions about how that's going to take place?
No, ma'am.
Okay. So I will be back with you in an hour to check on you. If you have any questions in the meantime, go ahead and let me know. Use your call light to call me or one of my colleagues, and we'll be in here to talk to you, okay? Would you like the curtain open or closed? Closed. I'll keep it closed. Is there anything else I can do for you before I leave?
No.
Okay, I'm going to wash my hands again for 20 seconds, and I'm going to document my findings.